Time to bear witness. Reporting Native American elder abuse. My name is Diana Cash, and I'm presenting this for Abrazo Arrowhead Hospital. First of all, I would like to thank those in attendance representing social services, case management, the directors of ED, Med-Surg, Tele, and ICU, and risk management. Traditional Native American societies have considered their elders to be the keepers of tribal lore. Their life experience and knowledge are held to be invaluable, and they are never to be considered as a burden. They are also important to the tribe's social structure and political process. Despite these societal norms, Native elders are not always held in such high esteem. The 2019 National Elder Mistreatment Study discovered that Native American elders reported a 33% prevalence of abuse, which is almost double that found for white respondents. This included physical, emotional, and sexual abuse, as well as general neglect. Signs of physical abuse include skin discoloration, edema, scabs, hair loss, hematomas, lacerations, burns, bruises and healing bruises, fractures, dislocations, broken eyeglasses, poor hygiene including the odor of urine and/or feces, perineal bruising, weight loss, disheveled appearance, bite marks or evidence of pinching, pushing, choking, hitting, spitting, or kicking. Signs of emotional abuse include fear, depressed appearance, disengagement in activities, violent episodes, agitation, anxiety, introverted behavior, disorientation, confusion, poor eye contact, rocking behavior, and shaking. Caregiver behaviors include controlling, ignoring, humiliating, isolating, threatening, or yelling at the victim. Signs of sexual abuse include orifice discharge, perineal bruising, bite marks, burns, and bruises. The victim may report participation in sexual acts or being forced to view sexually explicit materials. Signs of neglect may include pressure sores, unmet basic needs, report of an unsanitary or unsafe environment, or evidence of a lack of medical care or medication. Healthy People 2020 is an agenda established by the United States federal government to build a healthier nation. Using science-based evidence, 10-year objectives have been developed to improve health for all Americans. Benchmarking helps to visualize goals, while monitoring of progress gives feedback for areas that still need revision. Under the Older Adults section of Healthy People 2020, Objective 12.2 states, increase the number of tribes that collect and make publicly available information on the characteristics of victims, perpetrators, and cases of elder abuse, neglect, and exploitation. In order to help the tribes to collect this data, it is our responsibility to notify them when one of their elderly citizens presents to our facility showing signs of abuse. So how do we know who to call? The following is a list of tribal hotline numbers for the state of Arizona. The tribes and their locations include the following: Ak-Chin Indian Community, Cocopah Indian Tribe, Colorado River Indian Tribes, Fort McDowell Mojave Apache Indian Community, Fort Mojave Tribal Council, Fort Yuma Quechan Tribe, Gila River Pima Maricopa Indian Community, Havasupai Tribe, Hopi Tribal Council, Hualapai Tribal Council, Kaibab Paiute Tribe, Navajo Nation, Pascua Yaqui Tribal Council, Salt River Pima Maricopa Indian Community, San Carlos Apache Tribe, Tohono O'odham, Tonto Apache Tribe, White Mountain Apache Tribe, Yavapai Apache Tribe, and Yavapai Prescott. Now, because not all abused Native American elders may be from Arizona, this is a list of hotline numbers for each state. While there may be multiple tribes in each state, these numbers will help to connect you to the proper hotline number. So how much will this plan cost to implement? The cost will be minimal, requiring only the printing of the templates into two-sided flyers to be distributed at nursing stations and amongst the proper stakeholders, such as social services, case management, risk management, etc. Note that each template instructs the user to have a face sheet and any other applicable information in hand prior to calling. The templates can also be mass emailed so that even if a paper copy is not available, staff members can still have access to the original. The process can also be explained through those emails, and any questions can be answered in staff meetings or huddles. In closing, here is a quote from the Shawnee Chief Tecumseh. "Abuse no one and no thing, for abuse turns the wise ones to fools and robs the spirit of its vision." Thank you.